So hello, I'm Dr. Anna Huang. I actually am a graduate of Rosemead School of Psychology, which is where Dr. Huang teaches, that he was talking about earlier. He was actually my dissertation chair, so I have a pretty great relationship with him. He's one of my mentors, and he invited me to be giving one of the workshops here today. So I'm currently working with a lot of clients in group private practice. So what I spend most of my time doing now actually is individual and couples therapy, way out in Orange County. So just to give you just a background of what I'm doing now, since I graduated school, that's been my main source of income and me being able to live out my passion. And so one of the things that I'm super passionate about is confronting stigma, specifically in the Asian American community around mental health. And the reason I even got into this field was just to be able to look the way I do, and have the name I have, and be a psychologist. Just have more Asian American female psychologists out in the field. So I'll share a little bit more about my story as I go on. But first I want to just review quickly with you guys, what is stigma? And I imagine this is something you guys have, since you're at this conference, something that you've tackled and something that you've thought about before. So stigma is the display of negative attitudes based on prejudice and misinformation in response to a marker of illness. And kind of a more simple way to say that is that stigma is when someone views a person in a negative way just because they have a mental illness. So some people describe stigma as a feeling of shame or judgment, and it can even come from an internal place. So you could even stigmatize yourself for struggling with any sort of mental health issues. And so we can easily confuse, oh, I feel bad, I'm feeling depressed. Wait, I am bad because I have these sorts of feelings about myself. I'm realizing as you're all furiously writing that I have handouts with all this written already. So to save you from carpal tunnel, thank you for reminding me. Pass you to the rows myself. So what stigma does is it basically makes us have negative stereotypes about people who might have mental illness. So some of the common stereotypes, for instance, is that somebody with mental illness is dangerous, they're unpredictable, they can't function normally or do life things like get a job or live on their own or take care of themselves. And so this is something that I think is really important to tackle specifically in the Asian community because the stigma is extra strong there. So let me just give you some stats, first of all. Based on the US Census info, this is from 2011, so it's a little bit outdated, but so far there's 18.2 million Asians that live in the United States, which is 5.8% of the total population of the United States. Although Asians quantify, I think, about half of the population of the world. Asians are the fastest growing racial group in the United States. They had the largest proportional population increase between 2000 and 2010. And so the Chinese is the third most widely spoken language in homes in the United States, after English and Spanish. 28% of Asians live in a multi-generational family. And so that means there's at least 2 adult generations in the same household. So grandparents and parents, for instance, which is much higher than whites, blacks, and even Hispanic Americans. So we're constantly dealing with intergenerational differences. And there's a large within-group disparity with education and income. And so you guys have probably heard of the model minority myth, which is basically that Asians are doing really, really well. And to some degree they are. So if you average it out, Asians are more highly educated than the average American. So here's some stats. 85% of Asian adults over the age of 25 have a high school diploma, and half of them have a college degree. However, among the Vietnamese population, only 26% have college degrees, and this is actually lower than the overall US average that has college degrees over the age of 25. So you see the huge difference. We're either much more educated or actually less educated than the US average. There's a similar disparity with income. So the median income of an Asian household is $66,000. That's larger than the national median, but 12% of Asians live in poverty, and about 20% don't have health insurance. So you see the huge gap across the different Asian groups. And one of the major problems with Asian Americans is that we underutilize the mental health resources. So in general, mental health is underutilized. So I'll give you some of these stats here. That mental health conditions are the leading cause of disability across the United States. That means when you have a mental health issue, it's harder for you to work. It's harder for you to be able to carry out daily life functions. More so than even what we more classically think of as a medical disorder, like cancer or some sort of obvious physical problem. Suicide is the second leading cause of death of youth aged 15 to 24, and it's the 10th leading cause of death for all Americans. Less than half of the adults in the US who actually need services and treatment get the help that they need, even though most of these disorders are treatable and can be made better. The average delay between the onset of mental health symptoms and an intervention is 8 to 10 years. Very, very long time. That doesn't typically happen with a medical disorder. So with Asians, some of the data that we do have is that the propensity to use mental health services is inversely correlated to the generation of immigration. So what this means is the longer you've been in the US, the more likely you are to seek mental health services. So first generation, very unlikely. Second, maybe a little more likely. Third, fourth, fifth, you're more and more likely to actually seek things like therapy or psychiatric help, which makes sense. They're more acculturated. They're more comfortable with Western ideas of psychology. But the main takeaway, as I was trying to do research on this, is we just don't have enough data about mental health disorders in Asians and Asian Americans. So there's multiple reasons on that. One is that, as I just described, saying Asian is so general. Do you mean Chinese Americans? Do you mean Vietnamese? Do you mean Hmong, right? You could be talking about immigrants that came because they were selected by their government because they were so intelligent that they've been sent to the US. You're talking about refugees that just escaped from their country of war. So saying Asian is way too broad and general, even though I'm kind of doing this for the purpose of this presentation. The other reason is that the way Asians experience mental disorder is often very different than how somebody from the West would. So even the DSM, the Diagnostic and Statistical Manual of Disorders, so it's basically our Bible with all our diagnoses, when they list the different symptoms for depression, that could look really different for someone from an Asian background. So people from an Asian background tend to somaticize, which means they experience things in their body. So instead of saying, I feel sad and depressed most of the day, nearly every day, which is the first symptom to qualify for depression, an Asian might say, I have a lot of headaches. My stomach hurts a lot. I'm not really sleeping well. So doing a classic survey across the US population, Asians might not qualify as showing that they have certain mental disorders, even though they do, just because they experience it differently. Does that make sense? So it's really hard to get good data for this. So that's something I think is a really growing need in the psych world, is how do we edit different surveys, how do we gather data that actually includes Asian Americans? So what are some of the cultural and systemic barriers that keep us from being able to use mental health more? So I'm gonna go over 2 categories. So I kind of just arbitrarily did this. I would love for us to actually have a discussion and see what you guys think. But I thought of 3 cultural barriers that keep Asian Americans from really being able to use mental health services well. And the first one, and the biggest one, is shame. So a mental illness could indicate there might be some inadequacy in your family. Because for Asians, we're a collective culture. So if one person has something wrong, in some ways we're saying the entire family could have something wrong with them. And so that makes it really, really hard for one person to seek help. And so instead of going to outside services first, so I have a lot of clients, for instance, that once they've gone out of high school, they're now in college, they're much more willing to seek help because they're away from their parents. They can come get therapy, their parents never even need to know. As long as you're over the age of 18, you can come get therapy from me, and if your parent calls me, I'd say, I'm sorry, I can't confirm or deny if I even know who that person is. For Asian people, they tend to first go to their family for help, then they go to more traditional sources like an herbalist, an acupuncturist, their church community, as opposed to going straight to a therapist like me or to their medical doctor. So that relates to level of acculturation, kind of what I described before of the further along in generations you've been in America, the more likely you are to actually receive services because you're more familiar with how the US talks about mental disorders. You're more willing to go to therapy because that's something that maybe you know people who actually did. But if you're first generation, like my parents, they literally didn't know what psychology was when I told them I was gonna go get a PhD in it. So even though my parents were professors and psychology is one of the biggest majors in any college, no idea. So that tells you how different our generational differences are, that I was gonna go study this for my whole life, and I had to explain to my parents the basis of what it was and help them understand that it was a legitimate thing to study. So even in my own family, it was overcoming the stigma of like, this is real, this is important, it's not a pseudoscience, I am still a scientist, I can still get doctor in front of my name, and it took a lot of convincing even for my parents to get like, oh, this is something that's like value.
And so the final cultural barrier I selected was that there's limited knowledge of mental illness. So many Asians believe that emotional anguish is the consequence of bad thoughts, maybe a lack of willpower and self-control, or some sort of personality weakness. So huge generalization, but Asian Americans aren't necessarily known for sitting around and having deep conversations about our feelings, right? So it's really hard for someone to understand, what do you mean you're anxious or you're depressed? You just work harder, right? Like maybe you should just exercise more. Or when I was struggling with some things, my mom would call, well, have you had dinner yet? You should just eat dinner and then pray, right? And then make sure you get 8 hours of sleep. So there's a limited knowledge that, oh, well, depression is something that's actually impacting the brain, it's in the system, it doesn't just go away overnight, like it's a real disorder that we can get medication and other kinds of treatment for. Any other thoughts or questions on this? Things to add, agree, disagree? If not, that's okay too.
Yeah, I think the level, we don't know. Another thing is it's very hard. Our culture thinking is differently, we philosophy is differently. Even I see the psychiatrists, psychology in the American, their mindset is quite different. It's very hard to accept.
Yes.
Sometimes they even didn't think it's the mental problem. Some
Right.
psychology is kind of discipline problem. We spoil the kid, we didn't enable them.
Yeah, yeah.
It cause them unable to fit in society.
Yeah, yeah. So part of the issue that we're facing that makes it hard is the cultural gap even between providers, service providers, the doctors, the psychiatrists, and the patient going in. Yeah. Totally.
It's very hard to find the right psychologist.
It is, yes, yes. Which is a perfect lead-in to my next slide. Thank you. Well, let me summarize here. So for Asian immigrants, stigma attached to mental illness is a multifaceted phenomenon, which is related to loss of face or shame and status that is beyond the individual level. Okay. So there's a lot of systemic barriers as well for people receiving proper mental health care. The first one is a lack of access to resources. So many Southeast Asians, like Cambodians or Laotians, they're uninsured or they live in poverty. So a lot of Asians come from war-torn countries and they're refugees. They have higher rates of poverty, being uninsured, which makes it harder for them to actually have access to mental health resources. The other, kind of what you were just talking about, is a lack of language or culturally appropriate services. So this is something that my school really emphasizes, and is actually fairly new for schools to emphasize to their psychologists or social workers or MFTs, is we need to be culturally appropriate. So when I'm working with a white client, I might give them different advice about how to interact with their parents or make proper boundaries with their parents. I'm going to do that differently with an Asian client. I'm not going to tell my Asian client, just don't listen to your parents, they're totally wrong, like it's fine, do your own thing. Because probably the Asian patient will be, okay, yes, doctor, I agree. And eventually they're just gonna stop coming to therapy because they don't want to disagree with me because I'm the doctor, but really they're like, I can't do that. Like, I can't do what they're asking me to do. And so we actually read a lot of materials about instances like that happening to Asian clients. And so they tend to find that the provider isn't really understanding the context that they're coming from, so is giving them treatment that just doesn't fit for them. It's not the right context. I worked during my last year of school at the Asian Pacific Family Center, which was amazing, because it specifically required every clinician there to speak an Asian language, and it was all about providing culturally appropriate practices for our Asian clients. And so I was able to work there because I speak Mandarin, which is terrifying. They interviewed me in Mandarin. And I was working with a lot of first-generation people who had never encountered therapists before. And so it was so important that, first of all, we could speak their language, and then we could better understand their culture. So I would go to their schools or go to their communities to actually interact and see, what is the context that you're coming from? And how can I help you improve your quality of life in that context? There's also a lack of culturally sensitive information. I mentioned before how depression can look different for a white client versus an Asian client. And so I think we're still really trying to figure out some of those trends. We really don't know yet. I think it's actually just a growing field of, okay, we need to be culturally sensitive. We're not quite sure how, but we know we need to ask more questions, which feels like about the level the field is at right now. Any questions or thoughts on any of this? Okay. What are other barriers that you guys have experienced or friends and family you know have experienced to getting mental health treatment? Because I know my list is not exhaustive. Anything else you guys want to add? And if not, that's all right too.
I think another thing is the cost, like insurance.
Yes.
And just people, whenever they think of counseling, like, oh, how much per session? Like 100 an hour?
Yes.
And I think those who actually need help will tend to be like, I don't know, I don't want them to go through, to figure out how to get these things covered by my insurance, and I can't afford it.
Yes. Yes.
So I think that's a big one, because psychiatrists or psychologists, counseling sessions can be costly.
Yes. Yes. I agree. So part of the, I'll get to you in a second. Yeah, part of the systematic problem right now in the field of psychology as well, and probably overall, is how expensive graduate school has become for students, and not just in psychology, this is just in general. So I've taken on a lot of debt to get my degree, and so it is a big deal for me when a client cancels and doesn't show up for a session. I don't get paid if they don't show up, but I've been sitting there waiting for 45 minutes, and I can't just go home, because sometimes I have a client that shows up 30 minutes late, and I was thinking, gosh, I could have been doing something, but I'm literally sitting here staring at the clock, wondering if you're going to show up. But it is hard. At the group I work at, they just decide the fee for me. I'm not licensed yet, so I go by what they say. And so my fee is $150 for 50 minutes, which is expensive. How many people can afford to come see me weekly for $150? And the kind of therapy that I do, it takes months and months, maybe even years, because I really want to go deep. I want to understand, help you gain insight. So I struggle often with this idea that the kind of therapy, at least that I'm providing, is a luxury because of the price and because of the frame. So when I worked at Asian Pacific Family Center last year, that was community mental health, which means that the government funded everything. However, the turnover rate in that facility was so high. So clients could be there for years, and they've seen 10 different therapists during that time, which really disrupts the therapeutic process. It really disrupts, a lot of therapy is really just, look, I care about you, I have an ongoing relationship with you, I'm living life with you. If you have a new therapist every 6 months, that's really hard to do. Cons of each approach, and I think that's also just a struggle in the psychology world right now and how we're providing services. Yeah, you had a comment?
I just wanted to say that it's been since 1997, and when my husband was diagnosed with mental illness, at that time coverage wasn't available all the time. But I think today, people need to know that you can tell others, check your mental health coverage,
yes,
whether you have it or not, and we have to tell them to get it because it's nominal. Right. I think that's really, really important. That's all I have to say.
No, that's very true. Yeah.
It is. Yeah.
Yeah, this is kind of a separate discussion about types of therapy, but insurance companies are very stingy, you're right, with how much they provide for mental health care. And it's often they want a very specific problem. You're afraid of elevators. Okay, You get 8 sessions to deal with that. These are the 4 therapists you could potentially see, and that is it, right? I'm trying to help somebody like grieve the loss of a family member or like understand why they keep getting in abusive relationships. I can't do that in 8 sessions. It just isn't going to happen. I want to see somebody for months and months. And so some of these kind of more complicated issues, insurance just doesn't really know what to do with that. So that's part of also the struggle of, as a system, we're still really struggling with how to figure out mental health care overall to provide people the kind of care they need.
And plus for Asian culture, spending money to talk to somebody is like, what? I was not spending
Yes.
$50 talking for 15 minutes. I probably don't even get to say half of it.
Totally.
Or they just sit there and listen. They never said a word.
Mm-hmm.
I mean, I think for Asian culture, it's very hard to accept that. Like, at least I know if from my family, they're like, I'm not going to do that.
Mm-hmm.
I'm throwing $200 to talk. I can talk to you, you know?
Yes.
And knowing it's not one session will be done, and because they want quicker
Yes.
treatment and fix. So I think that's where for Asian culture is, they just avoid it. They don't see the value.
Yeah.
They really need the help, and I think that's a struggle.
Yes, I agree. That's a really good point.
Eventually, the family sees it. I think when my husband was diagnosed, my husband's Caucasian, but my family's Chinese.
Right, right.
So I would say all those years, I didn't have the supportive family.
Mm-hmm.
I think because they didn't know what to say.
Yeah.
But
Yeah.
that was okay. It really was okay.
Mm.
I thought, no, we have Christ in our family even before that.
Mm-hmm.
So I knew we were going to be process for
Right.
my husband and our children to go through.
Yes.
But even my own generation, my own siblings, they didn't understand. And
Yeah.
I didn't expect them to understand.
Yeah.
And I didn't even understand.
Yeah.
You know, it was for me to go through it also.
Yes. Yes.
Yeah. So anyway, it's important to ask.
Yes.
Do you
Yes.
have coverage?
Definitely.
Yes.
It's true. Yeah. Any other thoughts, comments? Yes.
I think sometimes the person may not realize he needs help.
Yes. Yes. One of the hardest things to watch, as now I do psychology as part of my job, is interacting with a lot of friends and family where I'm thinking, you might benefit from seeing a therapist. Not trying to diagnose you, but it could help you to talk through some things. But if somebody isn't ready or they're not willing to go, it just isn't going to happen. And so, yeah, a lot of people are in denial about ways they could get some help. Which in part, again, because of stigma, I think when you think of mental health issues, you usually think of, this is my bias, I think of the homeless person on the street that I pass that's like talking to the air. I think of like the most severe possible mental health, whereas I think the statistic is like 1 in 4 or 1 in 5 people experience depression at some point in their lives. It could just be talking through life transitions. It could be you don't even have a diagnosis, but you just want to learn more about your patterns in life and how you think about things and how you cope with things. But I think it's hard to admit what we might have a problem or a need for growth because we tend to think of mental health issues as being so severe. Yeah. Okay. Well, I wanted to spend the majority of our time talking about how we combat stigma. So what do we actually do? I'm assuming that's why you guys are here. So it's on the back side of this page. And so I took the 3 steps actually out of NAMI. They have something called the Stigma Pledge, I think, so we'll go over that. But I really like the 3 steps they talk about, and I just wanted to use that to even give you some of my story and how I ended up doing what I'm doing. So the first one is to learn more. So I think everybody knows that, okay, people can get sad, we know depression exists, we know some people get really sick, and we see in the movies all sorts of like horribly inaccurate depictions of mental health issues or therapy. But I think we lack a lot of basic knowledge about what actual mental disorders are, maybe what are the symptoms for them, especially in the church, right? When somebody is self-harming, like cutting or thinking about hurting themselves or killing themselves, I think we kind of panic and we don't know what to do. And until it gets to that point, we're also like, you're fine. It's not real depression or anxiety. So I think just learning more, some of the basic facts can be really helpful, which I know even some of the workshops today have been about things like that. So just an example for me, when I was in high school, I was going through a really difficult time. My parents were really struggling in their marriage and would eventually get divorced, but I had a lot of loneliness trying to figure out, what do I do with my family? And I can't tell anybody about it because my parents have told me it would be shameful for me to tell other people the distress that's happening in the family. So I still need to go to church and be a leader and sing on worship team and pretend that everything is going totally fine. And you know what? I'm getting straight A's, so everybody thinks that I'm doing totally fine. By Asian standards, everything is going well, right? I'm leading, I'm doing school. But I wasn't able to process with anyone the emotional turmoil of what was happening for me. And I wish at that time there had been more resources or more openness from my parents or even friends to help me recognize some of these are symptoms of depression or of anxiety. Like, just because you're still doing well in a lot of outside life areas like school doesn't mean that there's not a struggle going on inside. I think that's another issue with actually looking into mental health issues for Asians, is that we tend to look like things are still going well on the outside. Work is a priority, school is a priority, so nobody knows that you might be struggling when you go home at the end of the day. So learning more could have been so helpful for me, and I think part of why I got into this field is I wanted to learn more so I could help myself. Like, what was going on for me, and how do I recognize this so I can help others who are going through the same thing I'm going through. So they say in school that research is me search. I ended up doing my dissertation about how parental divorce affects kids and how spirituality can interplay with that, because I didn't want someone to feel the way I felt when I was growing up. So I think the first part of learning more is just being curious. And actually, I say this to my clients all the time. Let's just be curious about what's going on for you, or let's be curious about what's going on for your friend or family member that is struggling with something. Let's first listen and ask questions before we jump in with advice. Kind of what Dr. Huang was saying is first being present with somebody. So with my clients, even though a lot of times I have some idea of what's going on, first I just want to sit with them to see, what is the question? I can't give an answer until I first know what the question is. So I need to sit back and listen for what those questions are. Having a basic understanding of mental health is really helpful. And I'll show in a couple slides one of the ways to do that. Because I think the more you know about mental health, the more you can dispel stereotypes and false ideas. If you actually know what the symptoms are of depression, you can tell somebody, no, that's not correct. That's not a symptom of depression. Or maybe help someone realize, yeah, maybe you might be depressed. Maybe these are some resources you can use to get some help. As I was preparing for this, I got this email from Kaiser, so that's my insurance company, and the title was, "Let's change how we talk about mental health." It's like, thanks God for giving me this resource right before my workshop. But I thought this was amazing. So even going back to how insurance companies are changing how we talk about this, I was clicking around on the links. They say, know the signs so you can help someone with depression. So they're even encouraging, if you know some basic symptoms and basic understanding, you can help friends and family members who maybe don't realize they have a problem or they need help. So one of their websites that they created is called Find Your Words, which I thought was just amazing. I clicked through the site, and it has these 3 tabs at the top, so you could learn about depression. If you need support, there's even a little quiz on there to see if you have the symptoms of depression, and then supporting other people. And so there's a lot of pretty basic but easy to understand information on there that I thought was just amazing. Like, if somebody had shown me this website when I was in high school, I feel like it would have answered a lot of questions. And because it's on an official insurance page, I think it also would have helped my parents who, like, I only want to listen to the medical doctor. Like, see, this is a real thing. Like, these are the things that we can do. And what I love too is how much they're addressing stigma now too. So even the way they described it, many people keep depression hidden because of stigma, negative beliefs that can make people embarrassed or afraid to speak up and get help. So they're even encouraging just everyday people, learn to fight stigma, which I loved. So another just glimpse at some of the things in their website. Exploring attitudes, beliefs, and stigma. I love these stats. 89% understand that mental health conditions can affect anyone. 80% realize that people living with conditions like depression face stigma, and that 70% would be comfortable offering support to someone who is struggling, which gives me a lot of hope. I think we're really changing how we deal with mental health. We're really increasing our understanding, and I think that this is an important time for us to keep opening up these conversations. Okay, so the 3 steps. So we talked about learning more. The second one is leaning in. So getting to know a person that actually has, trying to have deeper conversations to understand what's really going on when someone is suffering with an illness. So my story is that I was going through some of my own struggles with mental health and ended up deciding to do psychology for school. So this first one is a picture of Biola University. We have this famous bells arch thing. And part of my motivation, as I mentioned, of going to school was working with Asian Americans and dispelling this kind of stigma. So I grew up in Ohio, in the Midwest, where when I last checked Wikipedia, is about 4% Asian. So very, very, very white. So even though I looked at the time for Asian therapists, there was none in my city. And I really didn't feel comfortable going to a non-Asian therapist because of a lot of stigma, because I felt like I couldn't be understood, which I'm realizing now is not necessarily true. But at the time, that's what I felt. I want to go to someone who looks like me and understands my culture. And so I really wanted to be that voice for somebody else. And so when I got the opportunity, the last year of clinical psychology school, you do an internship where you're basically a free labor slave for some sort of clinic or hospital or community. It's kind of like residency for medical school. And so I went to Pacific Clinics, as I just mentioned, the Asian Pacific Family Center, where everyone who works there is Asian. This is my other coworker who is actually a first-generation immigrant from China. And part of why I went there too was to help me interact with people that I previously was afraid of. Even though I was so far along in my program, I still was like, I don't know, schizophrenia kind of freaks me out. Like the homeless people, I don't know, they're kind of scary, they're unpredictable. And so I specifically chose a very severe site where people struggled with really severe mental illness because I wanted to kind of get down and dirty and really get to know people and help myself not be so afraid of them. And I think that's part of the huge stigma around mental health is we tend to be afraid of what these disorders look like in people. And it was really powerful for me. I worked with a lot of homeless people. One of the clients just lived in his car, and it felt miraculous to me every week that he even made it on time for our session. I did a lot of home visits because a lot of people were not able to leave their homes because of their mental disorders. Either they're so anxious or they really just didn't have the money or kind of the capacity to know how to take the bus to get to our clinic. So I would go into people's homes, meet them for the first time, know that they had a severe illness, but sit with them, often in a kind of dirty room, like really just to recognize that at the core, these people are people just like I am. They've really struggled with something. They have some difficulties, but they still just want my help and my kindness. And so I think leaning in, even to situations where I felt really afraid, helped me to grow my capacity to have compassion. And at the core, just recognizing their humanity. Yeah, so I just encourage you guys to find situations to sit down and have conversations if it comes up. I'm not saying like, you know, that person, I need to go talk to them, they look scary. Obviously keep safety in mind, and we had safety protocols, but I think don't be afraid to sit down and ask questions of people and get to know and get to see deep down that they're human just like any of us, and so there's nothing to be afraid of. So that's just part of my own story. I don't think everyone is necessarily afraid, but I do think mental health can freak people out. Like how it's even displayed in movies, right, is always like the person hearing voices, the person like acting in a wacky way, and that's just not true of the majority of mental health struggles. Okay.
So you talked about your story.
Yes.
Do you have any struggle for your identity as an Asian student? Grow up in the majority one?
Yes, all the time, yes.
So what could show that? Because sometimes I feel like I could not understand my son.
Sure.
I know their struggle.
Yeah.
So we have a cultural gap, we have a generation gap.
Absolutely, yes.
So we're far away from them. That's, I'm looking for how to get into the world to understand.
Yes, yes. I think one of the struggles of being second generation is that it often falls on us to help educate our parents to what our experience is too, because you have such a different experience from your son. And for me, growing up in the Midwest, I was in the only Chinese church in our city. And so I was with it felt like all the other Chinese Americans in Columbus. Really? Yes. Columbus Chinese Christian Church. I always have all the C's in the name, right? You have Christian, Chinese, and then whatever else. Yes, yes. So we were C, 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 C. And actually, my husband in the back, Victor, we went to the same church. Yes. Yes. It's a great city. So it really helped that we gathered together and could share similar experiences together. In my high school, I was one of the very few Asians. We made a club. It was called the Asian Women's Club to gather together, all like 5 of us, so that we could share experiences together. So that was really helpful in helping me not feel as alone in my experience. It was a huge culture shock to move out here for graduate school, and suddenly it was like the first time you go to like Irvine Jamboree Plaza, right? You're like, what is this? Like everything I wanted in China, I can get down the street. So I feel very spoiled, actually, to have this kind of experience. Or like if I want to, I probably don't even have to speak English, right? You can exist in LA and never learn English. But I actually think it's still a struggle. Like even in my grad program, I was still in the minority. At my place of work, I'm the only female PhD that is Asian. And I've had clients comment about that, actually, even as they come see me. Our sign-in sheet is just like all of our pictures, and he scrolled through and he said, "You're the only Asian female with your level of degree." So I think it's just a constant being able to talk with other people about it, being able to explore that with both Asians and non-Asians. I don't have like a simple answer for you of how I work through that identity, because I think it's still a process that I'm going through. My husband is actually a pastor, and this is the first year that we entered a non-fully Asian church. So we've always grown up in the Chinese church, and now we're in a majority white church that is trying to be more diverse. So he's the only Asian on staff. And we're having a lot of interesting conversations with people and really trying to constantly tackle kind of the little things they say that sometimes you're like, oh, like that's not okay to say that to me. And it's hard. It's hard to feel like you're educating other people about Asian culture as a whole. So yeah, it's just a continual engaging with that and learning more about your culture and other people's culture. Yeah. I know that probably doesn't answer your question, but just some of my reflections on it. Yeah. Any other questions, comments, thoughts? Okay. And the final what can I do is to take action. So for me, taking action was going to graduate school and then coming and speaking at conferences like this, even though public speaking isn't my favorite thing. But continuing to remember my original calling. I feel like my role as a clinical psychologist is a calling from God. And so remembering my original calling to keep speaking up, and not just for Asians, but even for mental health overall. And so that's one way that I'm doing it. Other ways to do it is to, for instance, NAMI has something called the Stigma Free Pledge. So if you go on NAMI's website, or just Google this, I think I put a link down here. You can take a quiz, you can take a pledge. There's ways that they will give you resources to help get involved. And it can be anything from getting politically involved, like doing legislation or fighting with insurance companies or getting involved in that level. And it's just talking to friends and family and being more open to having conversations about mental health. I think my biggest piece of advice is that it doesn't have to be specifically about mental health either, like, oh, depression, anxiety. But as you mentioned with your son, like just opening up conversations and just getting to know people first. I love what Dr. Huang said about just the power of being present with somebody. I think makes a world of difference. Any questions? That's all the material that I have, but I'm open to any general questions you might have about this topic or even just about clinical psychology as a whole. Yes?
How to find a psychologist, understand the Asian culture? Just call.
You have to call her.
That is
Like
such
she
a
said,
great
she's like,
question.
"We're happy," and
Yeah.
this is that almost like blocked her right away.
That's a fantastic question. I actually wish there was an easier way to find a psychologist that could meet your needs. Psychology Today is a good website that has just a lot of psychologists listed on it. So these are psychologists who have paid to have their listing on it. So I'm on Psychology Today, but you can actually specify, like, I want a female or I want a male. This is the zip code. These are the issues they have to be able to work on. You can even specify if you want someone who's Christian, for instance.
And the problem we need who understand the Chinese culture.
Yes.
We raise the kids in a very traditional Chinese family.
Yeah.
Speak Chinese every day. The value is Chinese.
Yeah.
Or we give the kids when we go to, for example, go to the American service, whatever.
Sure.
They will tell us independence.
Sure.
Which already added more problem to the it's just kind of a culture barrier.
Yes,
It's a very
yes.
big one.
Right, right. I think so. First, I think just looking, for instance, on Psychology Today, I mean, one way I currently am in therapy, and one thing I did was I just looked for Asian names because I really wanted to see someone who was Asian or look for their pictures. Another would be just to call Asian therapists and ask them for referrals. Because they are more likely to know other Asians practicing in whatever area you might be thinking of. Yeah. So when you're not sure, call somebody, ask them to help you find more referrals. So find someone who's already in the field and then see who they know. Yeah. Yeah. Any other questions, comments, concerns?
What do you think about the medicine for mental health? Because this is Asian,
Yes.
they usually deny for medical help.
Yes.
For my case, my friend, a lot of people friend reject. They say, you give your son medicine or mental health?
Yeah. Yeah. I think that medicine can be really helpful, especially for some specific disorders. So some of them, for instance, schizophrenia, or anything in the psychotic spectrum. So anything where you're hearing voices or having delusions, medicine can be really helpful for controlling and managing that. I think for the more common disorders like depression and anxiety, it can still be helpful, but I would always recommend it with therapy in addition. Because you might take medicine and feel like your mood is a little better, but the original reasons why you were depressed didn't magically go away because you got a prescription. And so I would always recommend them in conjunction. Yeah. I would even recommend really just trying talk therapy first before somebody tries medication. Yeah.
I have a question. I don't know. Is mental illness can it be genetic? Like
Yes.
you can.
Yes. So again, it depends on the disorder. So for instance, again, schizophrenia or things in the psychotic realm or bipolar disorder, very genetic, very hereditary. So just based on statistics, I don't know them off the top of my head, but like children might be more likely to have bipolar if their parents, one or both parents have bipolar disorder. There's some evidence too of depression or anxiety having some genetic factors as well. Yeah.
So is there any tests to identify genetic?
No, I don't think there is yet. Yeah, not really. And I think that's actually part of the hard thing with medication too, is that we have so many, for instance, antidepressants. We're not actually sure why they work. Dopamine or serotonin, but why does that reduce depression or anxiety? So it's still actually a relatively new field. So I don't think there's actual tests for that yet. No. Yeah. Yes.
What can parents do, cannot do when you have adult children who have mental problem? Legal problem.
Nothing.
Nothing.
Once
If they refuse to go to therapy, you cannot really do anything.
you cannot. Yeah.
The system with the
Yeah. So once they are over 18, there's nothing legally that you can do.
No, I just learned that this year. I was like, man, that's a big shock. I wish it was last year. At least I was like, man, last year 17, this year just.
I know. So this is encouragement to get all your kids in therapy before they turn 18, right? Like preventative, yeah. But unfortunately, nothing. So you can physically bring them in, and I might even, and I've actually had clients who like are forced to come in. they can sit on the couch and just stare at me for 45 minutes, right? It's back to the problem of if somebody doesn't want to work and try to get help, you just can't force them. Yeah.
One more last question.
Yes, of course.
I heard you say that you have a group survey. How you consider a group survey and the individual?
Yeah, so I have done groups before. So different types of therapy. Individual is probably the most common. There's couples, you can do family, and there's groups. So I worked at Loma Linda Hospital for a year where they did group therapy, which a lot of insurance and hospitals would do because you only need one therapist for 15 people. So it's better for more educational purposes, like for instance, working with a group of people who are recently sober from substance abuse. You can provide a lot of information and coping to them. But groups can also be really helpful in helping people understand their dynamics and how they come off to others. I'm working with months and months. All I know about their life is what they tell me, right? They tell me how they get along with their friends or their boyfriend or their girlfriend, and I just have to, I take what they say at face value. If I'm in a group with them and this person is very rude or very annoying, other people in the group can say that right away. Hey, I don't like how you just said that to me. So groups can also be helpful for people just working out dynamics and how they interact with the rest of the world. Yeah. Was that what you were asking? Yeah. Yes, yes, different types, yeah.
Especially maybe with Asian, I consider not the same male like the boys. They were more kind of seem to be academically very high, but pretty shy.
Yes.
So social anxiety and loneliness.
Yeah.
That's kind of consider the groups there to help.
Yes, I would recommend group for that.
But I don't know where to find.
I would look into a lot of larger churches for things like that. So I'm from the OC, so Saddleback is huge there. I don't know if I'm sure you guys have bigger mega churches here. A lot of the bigger churches offer different groups. So it doesn't even have to be therapeutic, but some sort of youth group, some sort of small group can be really helpful for people growing in social skills.
Yeah, so that's supposed to number one. After kids was born, we're supposed to baptize them first into the church every week. That's a history problem. So now at age 18, trying to bring them back to church.
It is hard, yes, yes. Yeah.
Can you give us some advice, like if you were to talking to someone, like not to identify you look like you need some talking, but if you genuinely care for someone and want to lean in, like you said,
Yeah.
when to like how far, if you may not know that person very well, but how far do you offer help or to listen to? Because what if someone is like, someone really care about me, I'm gonna pour out all my stories.
Yes.
Can you give me a ride home? Can I talk to you some more?
Great question.
I mean, how far do you draw the line with
boundaries? Yeah.
Like, I'm just talking about like first level of talking to people.
Yeah.
Like that you don't have any experience. What kind of advice would you give?
That's a great question. I think it depends on the context and then knowing your own boundaries for things. So if this, for instance, is you're volunteering at a homeless shelter and you're getting to know people, then the context would be you're probably not going to be taking anyone home or giving them a ride or taking them out to a restaurant, right? So I'm not sure how to answer your question in a succinct way, but I think just knowing what is the context and what do I feel comfortable with or uncomfortable with. So if you ever fear for your own safety, that's a boundary right there. Yeah.
I just wanted to add one thing. NAMI is a great program.
Yes.
And if you want to know more about what your son or daughter is going through, they have a 13-week program. I don't know where it is active, they aren't here, but it helps you to understand those who are going into depression, who is a schizophrenia.
Right.
It's just an exchange of what they're going through. Now, you're not talking to your son or daughter, but sometimes there are those who are schizophrenic or bipolar. It is excellent to understand. Then you'll know what your boundaries are because you understand their illness. And you'll understand more how to talk to them.
Yeah.
It really is helpful.
Yeah.
I can't say
Yeah.
enough
Good
about
point.
it.
Yes. Yes.
So educate yourself as well.
Yes. Definitely.
Even though you can't help them.
Yeah. Yeah.
I have a follow-up question. I'm the elder of this church, so I got to know some cases. One time, a church member, their son become kind of violent, and the one made to call police to come.
Right.
So in that case, can we call police and ask police to do something? What normally police would do? Can we force him to go to I don't know, go
A
to
hospital or
therapy,
something?
A hospital?
Sure. Great question. I wish that actually churches did a little more education on this for working with youth, but someone will only be taken to the psychiatric hospital if they are going to kill themselves or somebody else. So you can call the police and they can even come evaluate, but if they don't feel like that individual is in immediate danger of trying to harm themselves or somebody else, they're not going to be hospitalized. And even if they are hospitalized, it's typically for a 5150 is what it's called. It's for 48 hours, so 2 days. So basically it's 2 days for you to be in a hospital bed, probably go to a couple groups for them to hopefully calm down and rethink, like, do I really want to kill myself or this other person? So hospitalization is not going to be the long-term answer. It's for an immediate crisis. If there's physical violence, that is a little bit different. I would recommend calling the police. That's really hard for Asian families as well because they don't want to get, a criminal record. They don't want to get law enforcement involved. But again, I think physical safety is super important. And with youth that are being violent, one really hard thing to do but necessary thing is making boundaries, saying like, it's not okay if you're violent. So I did work on a lot of cases like that at Asian Pacific Family Center, and one of the hard things was how difficult it was to get people to call the police when really they needed to. Yeah.
So is calling police better than instead of calling the local community health? I think the county has some program, right?
Yeah, if it's an immediate thing, I would call the police. Like if there's an immediate danger or violent behavior, you can call your local sheriff. Does that make sense?
No, they have, I forgot the name of this, the local mental health, is it NAMI? They have some program, they come up with group people, with a psychiatrist, a social worker.
To do an evaluation?
To evaluate the situation.
That could be an option too, if that's a resource available.
But
yes.
that's not coming right away, right? They have some kind of...
Yeah, I don't know for sure about that program. I think if it's immediate, you might need to go to law enforcement instead. And I don't know about that, what you're specifically referencing, but I don't know if that'll actually go on some sort of record. Sometimes you need to build a record of infractions, problems, in order to, yeah. All right, thank you everyone. Yeah.